Yep. So we can say hi to everybody. So hi, everyone. This is Dr.
Hello.
Jennifer Gardella on behalf of BCHIP. We're doing one of our Facebook Live videos, and I'd like to welcome David of the Lenape Valley Foundation. David, welcome to our famous late Facebook Lives.
Thank you. I'm very, very thrilled to be here.
So why don't you tell us a little bit about the Lenape Valley Foundation and the good work you guys do?
Sure. So Lenape Valley Foundation's been around for about 65 years. It came about as a result of the deinstitutionalization of our state hospital system. And with folks coming out of the state hospitals, they needed some agencies that were local and community-based. And that's how Lenape Valley got its start. Didn't become Lenape Valley by name until the 70s, but we've been operating for over 65 years now. We provide, full array of outpatient and community-based services, crisis, which we'll be talking about a little bit today. And all in all, we have 37 programs. We serve about 15,000 individuals a year. Through our many programs, as young as 3 months of age, as old as 97 years of age. So we run the entire gamut.
Wow. So why don't you tell us a little bit about crisis services and what you guys provide? A little bit more detail.
Absolutely. Sure. One of the things that Lenape is known best for is that we are one of the crisis providers of Bucks County, really the largest provider of crisis services. We've been providing crisis services out of Doylestown Hospital, as well as Lower Bucks, where we have staff in the emergency departments of both of those hospitals, as well as a walk-in center down in Bristol, in a place we call the Lodge. We've been providing those services since, sometime, probably good 20 years or so. We've been doing walk-in crisis. We've also had mobile crisis services as well. That's a service that covers the entire county of Bucks County. We have two teams that work 24/7 and are quite busy, as you might imagine. But it's a great service. Folks who can come out, they can come out to the house, and intervene in a crisis that's going on. If the individual who is in crisis needs, further services that can't be handled in the community, then our crisis team does initiate having them go to a hospital so we can continue to work with them there. And we've also been doing crisis telephone for quite a bit as well for Bucks County.
And is that through a hotline?
Yeah, so we've had the Bucks County hotline for a long time, but one of the new things, and it should be live soon, within a week or two, is we're going to become Bucks County's provider of 988. 988 is the national suicide hotline, or crisis hotline. Lenape was very fortunate to be selected as the provider. 988 has been live in Bucks County for at least a couple of years now, but has not been answered by local folks.
Oh.
It went to another call center in another county. So now, when somebody calls 988 in Bucks County, they're going to get one of our crisis phone operators who are based in Bucks County.
And are those crisis counselors, are they, or operators, are they volunteers or staff?
They're staff, and they go through quite a bit of training. Our 988 staff is a combination of our phone operators who have been here for some time, as well as some folks that we just hired. But we've been working the last couple of months, actually probably more than that, on training for those folks. And we hope to go live as early as next week with 988.
That's fantastic. So why don't you talk to me then a little bit? So you have the hotline, you have mobile, you seem like you have everything.
Yeah, well, almost. What we're really shooting for, and this is, is nationally recognized as the best model, is really a full crisis continuum. And what that really entails is having the hotline, having phone crisis, having mobile crisis teams, having walk-in centers, having a stabilization unit, which is something that we're working on currently, crisis residential programs, as well as just the coordination and follow-up, which could be hospitalization, it could be, going back into the community. As an organization, we saw 988 as one of the things that we really needed to do to have that full continuum. But on top of that, we have partnered with the county and in providing the first dedicated crisis walk-in center in the county, one of the first in the state, really. And that will be called the Bright Path Center, and that is being built as we speak. Actually, I was just looking at it this morning. I was taking a walk around this morning on the grounds of Doylestown Hospital, and that's where we, envision providing most of our walk-in and crisis stabilization services.
That's awesome. So it sounds like you partner with an awful lot of people or an awful lot of organizations. So you must be really good at developing personal relationships or professional relationships.
Yeah, well, that's, it's really a testament to the organization more than anything. When the county wanted to do this, Lenape was the vendor that they chose, and we really appreciate that. But this has been something that's really been across a lot of the county offices, whether it's a drug and alcohol office or behavioral health. The county commissioners, all three of them, are big supporters of this project. Our legislators, no matter what side of the aisle, have been great supporters of this. And amazingly, we're able to build this facility through dollars that were acquired by these folks through grants, whether they're federal or state grants, as well as a lot of fundraising.
Wow, that's awesome. So you just talked a lot about how the county's been supportive. What about crisis that BCHIP helps you with?
Yeah, absolutely. So BCHIP and and I've been involved with BCHIP in a couple of the different organizations that BCHIP is that makes up BCHIP. I came here from St. Luke's and Penn Foundation, and we did a lot of work with BCHIP. But BCHIP, what's great about BCHIP is it do such a great job of looking at healthcare as an integrated thing. So it's not just behavioral health, it's not just physical health, it's the whole body, it's the whole it's the whole health of the individual, and trying to identify things that are either hard to access, or there's just not enough access to. And behavioral health and substance use disorder care has been something that BCHIP has focused in on the last few years. For example, I think the best example of that is the B-Cares program.
Right.
And B-Cares was established, through BCHIP, as well as Bucks County Drug and Alcohol, as well as the hospitals. And I don't think that B-Cares would be, and that stands for, by the way, if I can remember correctly, actually I wrote it down: Bucks County Connect, Access, Refer, Engage, and Support. And I don't think it would be here without BCHIP bringing all the hospitals to the table to really embrace it. And what B-Cares is it's really part of that integrated crisis continuum. What it provides is it provides a peer, or a recovery specialist who meets with an individual, comes into the ED, whether it's for treatment of a substance use disorder, and really came about because of the opioid epidemic that we've been experiencing over the last few years, especially with overdoses. That individual is a gatekeeper for services, but also just somebody who can really understand what they're going through, really meet them where they're at, and ensure that they get care.
Great. And so you then you're all part of all of these little services that are really helping to I'm not going to say solve the mental health care crisis, certainly, but provide support when people are reaching out. You're not hiding support. You really are very out there. coordinating care for many individuals, which is an astounding way to spend your professional career.
Yeah, well, and it needs to be a partnership because it's the issues that we're facing, especially since the pandemic, where we saw a real spike in crisis care and just folks that are seeking care. No one organization is going to be able to tackle that in any one county. So we have wonderful partners with the hospitals. We have wonderful partners with Penn Foundation and Pendel Mental Health, which are the other two base service units that came about as a result of the deinstitutionalization, as well as other organizations that have really been at the table. So, we have to take a team approach or we're not going to tackle the issue.
So at the end of the day, people watching now or long into the future, reach out for help. There's lots of help for Bucks County residents at many different levels of government, as well as lots of places like the Lenape Valley Foundation. A lot is coordinated through BCHIP. So David, thank you very much for the work that you do. It's admirable.
Absolutely. Thank you for
Any
the
final thoughts?
No, just what you said, reach out, and what we're trying to do as an organization is really just have a resource to the community that that there's no wrong door. Once the Bright Path Center opens, which we are envisioning that to be next spring, it's going to be a place that provides access for folks who are in distress or in crisis, whether it be a behavioral health or a mental health crisis or substance use. So there's no wrong door.
Awesome. Well, thank you.
Sure.
And anytime you want to come back and talk to us about what's going on, developments, you want to show us around the construction site online, well,
we could do that.
We're here.
Great.
Okay, thank you. All
right. Thank you so much. All right. Take care.